to episode 2 of 3 of the Foundation's report on the vitality of older adults in our communities. My name is Mira Backo-Shannon, and I'm a board member at the Oakville Community Foundation. I'm joined today by Sarah McPherson, Director of Philanthropy and Communications at the Foundation, and together we're going to explore the health and well-being and safety and risky behavior sections of the report.
Thanks, Mira. As in the first episode, we're going to ask you to keep in mind your personal goals as they relate to aging and consider how this information could impact them.
Throughout life, we develop many physical and mental health habits to keep us healthy and able to accomplish our goals. Some health challenges cannot be helped. There are steps we can take to help prevent or reduce the burden of chronic illnesses and mental health issues. As we age, we can remain physically active, get adequate sleep, eat healthy, and maintain personal health guidelines to help us meet our goals. The COVID pandemic has impacted how we stay healthy, while requiring new guidelines such as mask wearing, physical distancing, and vaccines. The pandemic is still ongoing and information will continue to evolve. The stats Sarah shall review were up to date at the time of publication.
64% of older adults in Halton report being active or moderately active. 36% report being sedentary, and 48% say they get about 7 to 8 hours of sleep per night. From January 2020 to May the 3rd, 2021, there were actually 476,000 confirmed COVID-19 cases in Ontario. Out of this number, 15,000 cases were among long-term care residents. And yet, of the 8,000 total deaths in the province, 3,900 deaths occurred in long-term care homes. 8 chronic conditions are prevalent in more than 10% of the population aged 65 and older, including high blood pressure, arthritis, back problems, eye problems, heart disease, osteoporosis, diabetes, and incontinence. Cognitive illnesses increase as we age, including Alzheimer's disease and vascular dementia, the most common forms of dementia in Canada. It is estimated that around 255,000 Ontarians are living with dementia, and by 2038, this number will be closer to 430,000 people.
Mental health challenges in older adults may not be recognized because some of the symptoms may be assumed to be a part of the normal aging process. These symptoms can be confusion, lack of energy, or issues with memory. Unfortunately, it's also common for older adults to face age-related stigma when they try and seek help from friends, family, or healthcare professionals as a result of shame and societal disapproval.
Overall in Halton, 76% of older adults 65 and older said their mental health is very good or excellent. This, in fact, is higher than the percentage of older adults in Ontario, which is 70.2%, and in Canada is 70.5%, those who rated their mental health as very good or excellent.
Some might think that risky behaviors are more common among youth. However, many older adults may partake in or be the recipient of negative behaviors. This includes bullying, drug and alcohol use, or undertaking activities that could result in injury. Some are subject to violent crimes or may engage in self-harm behaviors or contemplate suicide. These behaviors can lead to increasingly negative effects on independence, health, and mortality.
The number one cause of emergency department visits, hospitalizations, and death in both Halton and in Ontario are falls. Falls can lead to chronic pain, reduced mobility, loss of independence, and even death. Crimes against older adults in Halton are considered by nearly 43% of those surveyed to be an issue. Those crimes include theft, mistreatment, property crimes, cyber crimes, physical assault, forgery, and more. The most common police-reported abuse experienced by older adults in Canada is assault at 55%, uttering threats at 19%, major assault at 15%, and criminal harassment at 4%.
Bullying isn't something that only happens with children and youth, but is prevalent with older adults as well. Bullying happens when someone hurts, intimidates, or scares a peer consciously or unconsciously, and happens among older adults.
Now, as you can see in the chart, in the Halton area, 56% of older adults have reported being bullied. 36% have engaged in bullying behaviors, and 59% have witnessed bullying behaviors. Only 5% of Halton older adults report being a smoker or participating in heavy drinking. However, the opioid crisis continues to steadily increase. In 2019, there were 21 visits by older adults in Halton to an emergency room as a result of opioids, compared to 516 in all of Ontario. The COVID-19 pandemic has also exacerbated this crisis, doubling the number of opioid-related deaths among older adults in Ontario in the same period in 2019 compared to 2020. Males over the age of 85 have the highest rate of suicide among all older adults. This chart shows you that self-harm resulting in an emergency department visit in Halton per 100,000 is highest among males and females 85 and older.
There's so much information to be shared in this report, and unfortunately, we aren't able to share every data point and statistic with you in these episodes. To learn more about these areas of aging in the Halton community, go to our website at www.theocf.org to read the full report. Be sure to tune in to our final episode as we explore relationships, purpose, and opportunity, as well as next steps in our report watch list. Thank you for joining us.